I'm Dr. Marsha Sanity,
And I'm Dr. Caleb Moore,
and this is
the Free Smiles Podcast.
Today we are talking about some misconceptions
Mm-hmm.
in dentistry, just really in our field and really how we're perceived from the general public. And I think just how we're perceived going into this field, like how we think things are going to be versus how they should be. I think where we can start with that is really about how we both think about dentistry. Is dentistry really is more about people than it is teeth.
I think that it's a big misconception in the community that we treat and that we work in is that we are only looking at the teeth. There's so much more to your patient besides their mouth and what's going on inside of their mouth, right? And we want to focus on how we're making people feel and really taking care of the patient holistically, taking a look at everything. And so
Yeah, I agree. I think when I think about my patient, like when I'm having someone who I'm just meeting for the first time, which is quite often, you have people that come in for a limited exam, an emergency exam, a new patient. They come in and maybe they have one thing on their mind, like, oh, I have this, issue that I've been trying to deal with, or I have pain in this area, or I have no pain. I'm just here to hear what you have to say as a professional. I get that a lot, especially as a holistic doctor now. And what I usually start that conversation with is more like, what are your goals? What are your health goals? What are the goals that really stand out when you think about where you see your body and mind and health in 10 to 20 years? And most people aren't really used to having that question asked. I think in any profession, like any dental or doctor that you go to, they're not really going to sit there and be like, what are your goals? And they're like, what does that mean? And that's why I think it's a great question. It's just open-ended, and you can really take that wherever that person's thoughts are. Like it can be, oh, I just really want my gums to not bleed. My gums have always bled, and I don't want that to be a thing anymore. My mom lost her teeth when she was in her 40s. I don't want to lose my teeth when I'm in my 40s.
Yeah.
Something very simple like that, but really it really sparks that conversation of, okay, well, what do where do we go from here? And what do we look at today? And how do we focus that conversation? And how do we choose what kind of exam we do? Is that really truly a limited exam? Probably not. It's probably more comprehensive. And I think that's one thing I've learned just being in this field is that all exams that I do, I really want to try and figure out what that person is in for and what their goals are. And most of the time we're going into a comprehensive exam, more so than a limited exam, probably 8 times out of 10.
Or even a consultation, like you said.
Yeah.
I want to hear what you have to say. What do you see today? Can I get your opinion? Can we just look at things today? It's never just looking at things. Like you said, it's not a limited view of this area or that area. It's what are your goals? How can we treat you comprehensively to reach those goals and to get you where you want to be?
Yeah, 100%. And I think that's hard. It's hard to do because sometimes there are so many things on that patient's mind. Once you kind of open up that door of, oh, what do you want? Then they're like, oh, what do I want? Oh, I want my teeth to be whiter. Now it's like, oh, I want this to be a thing. And then, which are really exciting conversations. I think both of us really enjoy those conversations, and we actually want to spend that time with our patients. And when we can really just take that, 1 hour appointment and then kind of branch off into, hey, let's have some more time once we get the x-rays today. Like I personally love to see a patient for their initial exam and really look at their x-rays after they leave. Dive into it, like really focus. Like I don't have anyone else talking to me or, anyone else needing me. I'm just like at the end of my day, just re-looking at those x-rays and being like, oh, and sometimes more often than not, I see something differently than that initial time I'm looking at something. And I think having that clear communication with the patient, like, hey, we're going to look at things today, but later on, I'm going to dive deep into your images. I'm going to take photos today. I'm going to go or scan, and just really spend time. That's not your time. It's my time today where you don't have to be here, that I'm just going to come back to this and then we'll talk about it later. And I think patients really appreciate that because they know that you're taking extra time to look at them only. And it's not just that you're rushing things into that, 45-minute hour exam that you get with them. So what do you like to do for those exams?
Well, and I think to circle back on what you said, having those initial conversations with them and asking those open-ended questions. What are your goals? What are you here for? How can I help you? And how can we do this together?
Mm-hmm.
Because for some people, it's not always going to be a good fit, provider and patient, right? And I think we have to recognize that we can't say yes to everybody, and we're not going to be the right fit for everybody. So having those initial conversations and doing everything we can to make the patient feel comforted and to understand, why we're taking a look at things this way, but getting to know them in general, right? Asking those questions, I really want to come up with the best plan for you today. And to do that, I may need to take some time later on to look at these. Is that something that sounds good to you? Are you comfortable with that?
Yeah.
Asking that, let them give you permission to do that. So then that way, it's a mutual understanding of where you guys are going to go together, right?
Yeah, exactly. Because I think that patients come in because they're, the history of, dentistry is really like coming in, I have this problem, we're pulling this tooth. Like, it was very much like back in the day, like we were pulling a tooth because we didn't have the materials to save teeth. Like this is obviously like years and years ago.
Right.
But like that's kind of still a misconception of like, hey, I had this one problem, that's why I'm here.
Yep.
And I think when you really open up that conversation to a patient and really form a relationship, like when you're forming an open relationship where someone's comfortable with you, they're truly going to be like, oh, now I can actually focus on the things that I didn't think I could focus on.
Mm-hmm.
I can really sit down with this person and be like, hey, I'm really actually worried about this part of the procedure. I'm scared about this.
Right.
And I think that's a very vulnerable place for a lot of patients to go, and even practitioners. Like I have found that the more vulnerable I am in just sharing details with patients about myself, about my own experiences, about, surgeries that I've had, when they ask, obviously, I'm not just like divulging like, right. Hey, this happened to me. But, I think it makes people feel comforted the more they get to kind of know us as people. We're just everyday human beings. We're the same as they are. And that can really open up the pathway to really like helping people with their health,
right.
And meeting what those goals are and giving them, a lifetime of thriving with things instead of suffering from pain and suffering from things and dealing with, chipped, cracking teeth that really shouldn't be chipped or cracking if we're really getting down to the root of the problem.
Mm-hmm.
And I think that we both value those relationships outside of, our field. And
right.
we really find that at the end of the day, we get more joy out of making a connection with a person than doing a procedure.
Yeah, and I think too, to take it back, we're still going to address their main concern always, right? Whatever they're coming in for, if it's one tooth that's broken or this tooth is chipped, and we want to make sure that we are coming up with a plan that they're comfortable with, right? Mm-hmm. And we want to make them happy. We always want to make patients happy, but we have to do that with realistic expectations and set expectations that if we just focus on this tooth today, I am more than happy to do that for you. But what are the long-term, effects of that? If we just fix this today, is it going to last you? And are you open to having the conversation to talk about setting this up for success long-term, so that way you're not having to come back so often with these types of issues, right? And I think that's something that you do very well and that I do very well. And like you said, we get reward from that because we're educating patients, we're helping them, and then we're treating them holistically. And then we're only having to see them for maintenance instead of these major issues that they're coming in for. And so I think that creating that initial relationship and having those vulnerable and sometimes even tough conversations, right? Sometimes that leads to tears. It's a very emotional experience for them. And so I think spending the time with them and really utilizing that time to get to know them and what they want and what they're looking for, and guiding them on a path that is going to lead to long-term success, then that's going to lead to better relationships in general. So, yeah.
And I think it honestly leads to better relationships across all dentists, because I don't know about you, but I have a lot of patients that I see for the first time, and they reflect on that bad experience. They reflect on that,
Mm-hmm.
one time when I was a kid, this is how I felt when I was in the chair, or, the last doctor I saw really, and it's not that that last doctor did anything wrong in the procedure. It's
No,
how that patient felt during that procedure. And I
exactly.
think the more time we spend creating that like comfortable environment, and it doesn't take money to do that.
No.
I mean, maybe a little bit of time, but I guess you could say time is money, but not really. I would spend more time with the patient just because that's going to lead to more success for both of us later
Right.
on. It's when that patient's comfortable, I'm more comfortable. I don't
Mm-hmm.
like when someone's in pain.
Because then things aren't going smoothly. Exactly. They're not going smoothly for you. We have set time aside throughout the day to do this procedure. And and then they're not going smoothly for the patient, right? At the end of the day, our goal is to have them have a great experience while they're in the office and to tell their friends, right? We want them to, referrals are the best source of our practice growth. And I think that to have that, they have to have a good experience. It's not to say that we still don't have to get them numb, right? And go through these things that may be uncomfortable for them, but having them have an understanding of what to expect during the procedure, what not to expect, that's going to allow us to be efficient and to have the best success and clinical outcomes, and also for them to feel great when they leave the office.
Yeah,
so
100%. I think there's this underlying part of just healing that is mental. I would say probably most of the time when we're doing like a surgical procedure on someone, really if they feel comfortable and taken care of and they know like how things are going to feel afterwards, when I do my post-op call, because I always call a patient after I do anything, just to see how they're doing and just to check in on them. I would say 99% of the time they're like, no, I feel great.
Right.
I feel better than I expected. That's like, I think the best thing we can hear is I feel better than I expected.
Yeah.
So, and that does it. It gives you the patient confidence. It lets them relax. It lets their body heal. They're not just like spiking cortisol for the whole weekend when they're trying to be like, oh, is this normal? Is this what's supposed to happen? So I think having all those pre-conversations, and obviously we always give like written instructions for things like that. But
it limits the unknown. And the unknown is what's causing them anxiety, and I think that the better we do in the front end of that, the better that the procedure is going to go, and like you said, the outcome long term. So
yeah, and you're right. Like it comes from how that person feels walking in from beginning to end, how that person was greeted when they walked into the door, how the assistant, seated them, and how they made them feel comfortable, and were they able to ask any follow-up questions to the assistant? Is your assistant competent to know, hey, I can answer these questions, but this question I'm going to direct to the doctor.
Right.
And it gives your team empowerment to know that they can also just kind of take on some of those things the more and more comfortable that you make them feel, and the more consistent we are with things. Like there's certain things that I always say to a patient with certain procedures, and my assistant can probably rattle that off like a script almost,
right.
Because there are certain things you kind of touch on with each thing. So I think having that team empowerment and knowing that when I leave a room, I know my assistant or my hygienist even is going to kind of carry that conversation. We're all going to be on the same page. I think that makes that cohesiveness really, really valuable.
And empowering them to figure out not just the why, but the emotion behind the why. So why do you want this tooth fixed? It's not just because they want it to be whiter or so they can chew their steak, or whatever it may be. It's how are you going to feel if you are now able to do those things, And so I think that setting our team up to be able to have those types of conversations with patients and really getting to that emotional side of things from the get-go, then that allows us to come in and enter into a space where there's already trust, right? And there's already an environment that the patient has an understanding that we're here for them and we care. We care about what their goals are and how this is going to make them feel. How can we change their lives, essentially, even if it is just fixing one tooth, right? It doesn't have to be this huge case or treatment plan. It's the little things, but it means the world to them. So like you said, I think empowering your team to have those conversations in the beginning is going to break down those barriers.
Yep. And I think part of that is open-ended questions.
Mm-hmm.
I don't think there's ever a question that I ask that's a yes or no answer, because really to me it's more about listening than it is me prompting, because there's certain things you have to like kind of ask to get to the bottom of certain things what we're doing. But if I'm asking a patient a lot of open-ended questions in the beginning, then I'm getting kind of how they're talking to me, the kind of words they're using, the body language that they're giving me when they're, even just sitting there, or that, are they slouched over? Are they looking more at the assistant? Are they looking more at me? Like, are they, touching a certain area? Are they really confident? Are they a little more standoffish and being a little more aggressive? And it's just going into those things that you kind of read the room a little bit. And I think that takes time. And that's a really hard thing to train, I think, is like training not only yourself, but your team to really like read how a patient is and not increase that combativeness. Because some people are coming because they are scared, because they're in pain, or they are reflecting on that one last experience that they had, or maybe they just had a huge financial burden fall on them and now their tooth's causing them pain, and they're just thinking like, oh my goodness, this is another thing. Like, I think we all have that moment. Like when my husband has something wrong with his truck, and then we have this thing happen in our house, and then this happens, I'm like, okay, how do I just take a deep breath?
What's next, right?
Are we going to be okay? And that's, is he going to have an injury that we're going to have to, like all these things are kind of racing through all our minds as humans. And I think if we kind of take a step back and truly make this just a genuine human interaction, then people kind of relax. They're not like, oh, this person's just talking at me. They're talking with me. I think we kind of go back to this thing of like, things are learned over time. I think I felt this way, going into dentistry 18, almost 19 years ago, was that it's not that we came into this field feeling like, oh, like I'm a gifted doctor or I'm a gifted practitioner. It's like, no, you do the reps. That's like the one thing I always thought about, like even going into dental school, like if you were someone who kind of needed extra time with hand skills, or you needed extra time with whatever that subject is that you hated, maybe it was physiology, maybe it was pharmacology, anatomy, or even dental materials, which I think at the point was my least favorite, but I think I love now. Everyone has to focus more on something because they're not the best at everything.
Right.
What was the one thing that you started doing? You were like, oh, I need to like spend more time on this.
Yeah. And I think, like you said, a big misconception is that, we come into this field and we can't, and a lot of doctors think I am so gifted and I have been able to get into dental school and excel while I was in school. And now coming out of school, I'm going to do so well. But that's not the case. Like you said, you have to put in the work and you have to have the reps, because over time, the more things that you see, the more outcomes that you're going to see and that you're going to be able to learn from, right? Because not every outcome is going to be the same. And so, for me personally, it was types of materials to use. And I think that, learning that in dental school, I had a really good foundation on speaking to patients from being a hygienist and seeing, 12 patients a day or whatever it may have been, for multiple years. I had those repetitions of having conversations with people and reading people and understanding, what their risk was of developing decay and how are we going to treat that, and co-diagnosing. All of those things were pretty set up for me, right? I was lacking was, when am I going to choose to use an Emax versus a zirconia, and what's the science behind that? And so having that vulnerability and, being honest with myself that I need to spend more time in these areas and I need to do more research so that way I can give patients the best materials for their unique, presentation. For everyone is different and there's not a cookie cutter way. We have different options in dentistry for a reason and different materials. So, I think for me, it was just spending the time to learn them and to know when to use them and when not to use them.
Yep, 100%. I think something as simple as, a facial composite. There are so many, and I'm so thankful, for the current office that I'm working with, is that the doctor that I I'm kind of mentoring under, and the owner of the practice is someone who truly spends like endless amounts of time researching like what's the most biocompatible composites on the market, what's the one that actually has the best handling, because even though something might be more biocompatible than the one next to it, but they're both still like considered biocompatible materials, maybe that one's really hard to work with.
Right.
So when you're using it in your hands with your instruments, is the outcome of that going to be to the same caliber? Like, are you going to have the nice margins that you wanted to, or is the aesthetics of that going to be as good as the other one? All these things kind of come into play, and you can do a deep dive into this per everything we use, from the bonding agents we use to, does your flowable have fluoride in it? Does it not have fluoride in it? Is it, does it have BPAs? It can really be overwhelming. But I think truly, like, if that is an interest of yours as it is mine, I think that the time we've spent trying to understand these things, our patients really do appreciate it, because when they're coming to us, like, not that they want to know, because some patients do actually want to know these things. I think more so at my office than your general office. They want to know what's being put into their mouth, because that's their body. I don't think I would have a surgery where, they're putting something into it, and they're like, oh, it's just this weird material that's never been studied. And it's like, well, why would I want that as my, So I think that part of it's huge. And I think just having the almost humility to be like, I don't know everything coming out of school.
Exactly. Which
you think would be kind of common. But I think a lot of people leave school thinking like, I do know a lot, which you do, but we don't know anything. I think it comes back to just doing the reps, taking the time, like spending your time getting better, developing your techniques. I mean, I always think of like Tom Brady as an example of someone who was not the best in his field going into it. He was like one of the 6th round draft picks of the NFL, but he ended up being one of the best quarterbacks, arguably.
I can't fact check that, so I don't know.
I just watched his roast, and it's actually very funny. But it's just one of those things, like the people that end up being the best in their field weren't the one that was, coming into that being like, oh, I have a perfect score on this exam, or I have a perfect score on this, because that's just, you're going to have an off day in dental school. You're going to have times where you're like, this isn't my comfort zone. I need to work harder on this. But I think the people that have to work harder on things end up being better at those things. Right. Especially when it comes to hand skills.
But reflecting on that as a practicing dentist who may be stuck in their ways, these materials and the treatments that we're providing, how we're doing them, the types and the techniques and the way that we are providing care for patients is always changing. And so staying up to date on those things and humbling yourself in a way that I don't know everything, and I may know the best way to do this today, but in 4 months from now, there could be a new way to do it, right? And there could be new materials that are out that are better. And so always staying up to date on those things. And I think that's really important. Investing in yourself, investing in your career and in your education, not only for you, but for your patients, and to give them the best care. And I think that's something that people should just really focus on throughout their career.
I agree. And I think that's an important thing when it comes to people outside, just, trying to find a good dentist, trying to find a practitioner that you trust, is really knowing that that person really is invested into continuing education. And you don't have to spend thousands of dollars on CE. Like, there's a lot of really low cost education things out there now. Not that we have more like, web-based learning. You can really learn anything from anywhere in the world, from anyone in the world. It's a very different time now than it was like 20 years ago, when, dentistry was done, I think, very, I would call it like the archaic times of like doing things, but not that they weren't done well. I just think we see things differently now because we have such a plethora of knowledge that's just literally at our fingertips, and you can just spend, as we have, hundreds of hours just doing just deep dives into things. which kind of takes us to our next episode, which is going to be really just honing in on how to find the right CE.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.